Reducing deaths, protecting health workers and developing a vaccine. Those are the priorities of the World Health Organization, set out as we go on air after a two-day meeting of health experts in Geneva. They put together a global call to action to tackle coronavirus, which they've now renamed COVID-19. Our health correspondent, Victoria MacDonald, is in Geneva. And Victoria, we'll come back to that meeting in a minute. But first, if you could just bring us up to date on this breaking news about the first case in London, please.
Yes, we understand that it was a woman from mainland China who flew into Britain and who is currently on her way to St Thomas's Hospital in South London, where they have a specialist centre. That is as much as we know at the moment. It was always expected that we would get cases here, and the public health system is set up very well, so we're told, to be able to deal with this.
And now what about the WHO meeting that you've been listening into?
Yes, they've spent two days with more than 400 experts putting together a blueprint, a roadmap, so that they don't have any gaps. They want to know where the research should be. They want to know how they can prevent deaths, what sort of vaccines need to be developed. They say that they've got 4 vaccines that are potential, and maybe 2 of those might be in human trials within a few months, though not anything ready for maybe 18 months. What is critical is that they have put together this plan, because in the past there have been gaps. This is what the Director General had to say just now.
As we speak, research groups are meeting with the leading research funders to start work immediately on the most pressing questions. Some of these issues include easy-to-apply diagnostics, the best approach for infection prevention, potential therapies that could be used to treat patients, existing vaccine candidates and how to accelerate them, and how to address the infodemic.
You can see there are a number of questions that they have to answer, and there are numerous questions that are unanswered. Not least, why have there been no cases reported in India, Indonesia and Africa, all places where there is a lot of movement between China? So there are questions, queries, worries actually that there haven't been any reports. But this is how the day and the last 2 days have unfolded.
When they went into hospital, they were diagnosed with novel coronavirus pneumonia. Discharged yesterday, they are cured, and the disease is now called COVID-19. Not much else has changed, though. Experts still don't have the answers to some critical questions. How contagious the virus is? Can it spread without people showing symptoms? They're even unclear on the death rate. So scientists meeting at the World Health Organization in Geneva have developed a blueprint to help speed up the information they need and to develop medicines to vaccinate, treat and cure.
This meeting is a direct result of lessons learned during the West Africa Ebola outbreak, because while they were eventually able to develop a vaccine, they also found that they had huge gaps, particularly in research and development, and they don't want that to happen this time.
The blueprint outlines how to mobilize international action, produce a global research agenda, accelerate the development of medical products to control the outbreak, and increase the understanding of the disease.
I'm sure that everyone feels terrible that so many lives had to be lost in the West Africa Ebola outbreak before we could get our act together. We don't want to see that, and in fact even the deaths that are happening on a daily basis in China, you can see that everyone feels bad about that and wants to do something to stop it. So it doesn't matter which country is affected. Somehow there seems to be now, at least in the scientific community, a desire that a global public good is something that's driving people.
Information from previous coronavirus outbreaks like SARS in the early 2000s means vaccine developers are not starting entirely from scratch.
People are dying as we speak or have already died, so it's never timely enough in an outbreak session. What I see, what I hear, what I feel, what I also feel myself, is that people are doing really the very best and beyond to be as quick as possible with the learnings from other outbreak situations in the past, like H1N1 or Ebola. This is being integrated so that things can go much quicker now.
Room service with a difference, protection suits, delivering food and temperature checks. This is a hotel in Hubei province currently in quarantine. The Chinese authorities are claiming that overall numbers of new cases of COVID-19 are falling.
The daily number of new confirmed cases dropped to 2,015 on Tuesday, from the peak of 3,887 recorded on February the 4th. The daily number of new suspected cases has also lowered.
But medical experts are cautious, saying there are too many gaps in the data to know how meaningful this is. And in Wuhan, the numbers remain overwhelming, with reports of the authorities requisitioning private hospitals, hotels, apartments, cars and even face masks. So far, more than 45,000 people have been diagnosed with COVID-19, and there have been 1,117 deaths. The numbers outside China remain tiny, but containment is everything, stopping its spread while scientists seek the prevention and the cure.
Victoria MacDonald reporting from Geneva there. So as we've heard, it's been revealed in the last hour that a woman who flew into London from China a few days ago is being treated for coronavirus, bringing the total number of UK cases to 9. She reportedly developed symptoms after landing at Heathrow and is now in a central London hospital. Meanwhile, health officials in Sussex say that they've traced all close contacts of 2 GPs who've been diagnosed with the illness. Several schools in the Brighton area have said that parents can choose to keep their children at home. Aisha Tal reports.
A community watching closely but calmly. In Worthing, in Brighton and Hove, people are taking precautions and asking for more information on COVID-19, known as the coronavirus. And here in Worthing, one of the 8 confirmed UK cases works in the A&E department of this hospital. And just outside, people are more aware of the virus than even yesterday.
Are you worried about it? Do you get a sense that people are getting a bit more worried and a bit more panicked?
Getting a bit more worried, a bit more panicking, because every time anybody sneezes or coughs or anything else, they get a bit putting their hands up, putting their coats up over their mouths and everything else. But a lot of people have just got common colds.
But if we panicked every time they said there was an illness out there to be cautious of, I mean, is it really worth it?
More schools are taking action. Parents have been told they can keep their children home. At this school, kids say their classrooms are nearly half empty.
Everybody turned up at your class?
Yeah, 18.
18, how many's usually?
32.
32, so a lot of, it's half term at the end of the week, isn't it? So I suppose just be careful, perhaps.
I called the school and hopefully they said like nothing.
But can I miss?
You can miss, but if it's here, it's everywhere, so I wanted to miss because you want to stay home.
Yeah.
So let's take a look at all the places that have been taking precautions. More than 10 schools across the region have given pupils the option of staying home. 5 GP surgeries closed briefly, most have reopened. A community centre and a pub have also been affected. But a lot of this is precautionary and is related to the suspected but not confirmed contacts with the virus. The man at the centre of the virus outbreak, Steve Walsh, has been released from hospital. In a statement, he said,
"I'm happy to be home and feeling well. I want to give a big thank you to the NHS, who have been great throughout, and my thoughts are with everyone around the world who continues to be affected by the virus. It's good to be back home with my family."
Public Health England say they've now traced and given advice to the patients of the 2 GPs who had caught the virus from Mr. Walsh. Today in the area, there's been lots more awareness, and with that, a demand for more certainty. Some people that I've spoken to today say they feel that the council has been missing in action. So I gave the council a call, but their mailbox was full. It seems like they've been inundated with calls. So what I did was went into reception, and a spokeswoman told me that they want to reiterate that schools are still open, but some schools have given parents the option of keeping their children home if they want to. And they also reiterate that if anyone feels unwell at all, that they should call 111. For now, there are no new confirmed cases. Places are reopening. The man at the centre of it all is back with his family. None of the 8 people who are confirmed to have the COVID-19 virus caught it inside the UK, but health authorities are still on high alert.
Let's return now to our top story on coronavirus and the outbreak in Brighton. The local MP there, Green MP Caroline Lucas, joins us now from the House of Commons. Caroline Lucas, there's a lot of panic in Sussex generally. What do you think that parents or the elderly should do? What advice would you give them?
Well, to be very honest, I don't think it's for an MP to give advice. I think it's for Public Health England to be giving that advice. And what I would love to see is a lot more proactive advice being given by Public Health England, by our council, by the NHS. I think at the moment the information is being put in different places. It's not all in one portal, for example. And as a result, I think anxiety is growing. So what I would love to see is a much more coherent, consistent, proactive public health campaign, both nationally and locally, because people are coming to my office, for example, they've got the message about tissues and about washing their hands, but they're still struggling to understand, for example, what self-isolation really means. So I want to see a lot more information coming out from government and indeed locally too.
And why do you think it is that the authorities aren't being straight with people? I mean, is there a kind of cover-up going on here? Is the situation worse, or what do you suspect's behind that?
No, I don't think that at all. I think that people are trying to get the right balance between reassuring people, not inducing panic, certainly not revealing any kind of patient confidentiality. And I do recognise that that is a fine line to tread. Nonetheless, I think that on this, they have actually erred on the wrong side of the issue by withholding more information instead of being as open as they possibly can. So, for example, the council, I would love to see them have one portal where all of the information goes, because otherwise people look to the local papers, for example. One of the local papers is being pretty sensationalist about it, I have to say, and I don't think that's very helpful. So if people were able to get timely, accurate information all in one place from either the council or from Public Health England, but make sure people know which it is, then I think we would have less anxiety rather than more.
Are the authorities being straight with you? Are you getting briefed or not?
I am getting briefed. I mean, obviously, I don't know what I'm not being told, but certainly I am in close contact with Public Health England and with the Chief Medical Officer's office, and I welcome that. But I just feel that, first of all, that the different initiatives aren't sufficiently joined up, so there isn't consistent messaging coming out. My mailbag is full of people who've got all kinds of questions about, for example, what self-isolation really means. What does that mean if they're in a shared house with other people who aren't their family? So, perhaps they can't ask them to go and do their shopping for them or whatever else. So I would like to see some more practical answers being addressed. And as I say, I think nationally we need to see more of a joined up public health campaign. And I think we also need to see, a real crackdown on the stigma that is already happening. I'm hearing about racism at the university, for example. I'm hearing about, the kind of stigma that comes along with the language around super spreaders. There's no such thing as a super spreader. We shouldn't be using language like that. The person in question actually did exactly what they should have done as soon as their symptoms were apparent. So I would like to see us dial down the sensationalism, but I think one of the ways of doing that is filling what can sometimes feel like a bit of an information vacuum with more information, not less.
Well, what are the authorities telling you, for example, about what parents should do about sending kids to school? Or have they told you not to share what they're telling you?
They haven't told me not to share it explicitly, and I'm sharing what I can, but I think that it's just important that people get that message direct. And so they are saying that, if there's someone else who can take your kids to school, then that's great. But it also comes into the question about, whether or not you think you have had sustained contact with someone who is a confirmed case. So it is a complex set of messages, but I still think a lot more could be done to make that clearer on the websites and through a broader public health campaign.
If you've got a child, and you know that someone in the school, as is the case in the Varndine school, for example, says that a person from our school community, not being explicit who, if you're a parent at that school, should you send your children to school there?
Well, I want to quote Public Health England, not myself. I don't think MPs should be making those judgments, but Public Health England have said very clearly that they think it is fine for students to continue to go to that school. So I would simply point them to that. But the very fact that people are asking that question suggests to me that that public health message is not getting out as loudly and clearly as it should.
There also seems to be very different ways of treating this disease within your constituency. For example, Worthing Hospital, so that's where one of the 8 infected workers worked, that hasn't been closed or disinfected as far as we know, whereas the GP surgeries have. Is that discrepancy a problem as far as you're concerned?
I think it does beg questions, and that's my point really, that if we had a portal where people could go and see what's going on and why it's happening. I mean, when it came to the issue of, closing health centres and so forth, I understand that had to be done so that a deep clean could happen. But I also heard from Public Health England that it was not their advice that health centre had closed. So, there will be discrepancies in the way different people deal with the problem. All I'm asking for is for consistent information to be available to people so that when they notice these discrepancies, they can go onto a website and find out if there's a reason for it.
And we know from the WHO just now that what we don't know is whether we're at the start, the middle or the end of this outbreak. Could the NHS in your area cope with a dramatic escalation in cases, do you think?
I'm not aware that the NHS could cope anywhere with a dramatic increase in cases. We know that the NHS is at the very limits of what it can sustain just about across the country. So that is a real worry. On the other hand, given that most of the advice essentially is to stay at home, not to be turning up to A&E, phone 111 if you think you've got symptoms, don't go somewhere where you might be able to spread the disease further. Hopefully some of the pressure on the NHS won't be directly from people going to A&E.
Caroline Lucas, thanks very much for joining us. Matt.
Thanks, Kathy. Now, let's go back to Geneva and the headquarters of the WHO. Dr. Sylvia Browne is the Director of Pandemic and Epidemic Diseases at the World Health Organization. Thanks for coming on the program. I mean, how far are we away from a global pandemic at the moment, as far as you know?
So currently, we have the epicenter in Hubei province and then few epidemic foci in China. But outside China, currently, we have around 440 cases, and so we cannot say it's a pandemic, even if we have those few clusters of cases in 24 countries. But in each of these countries, the contacts are traceable. We know the chain of transmission, and the authorities are reporting regularly the cases, but things are under control. And we have even information from Singapore, for instance, and they are testing much more cases than necessary for this kind of situation, beyond, I would say, the case definition, just to check if there is transmission that they would not have detected. But so far they say that for all the tests they have been doing, I mean, they are all negative.
Okay, but so, for instance, we've heard no report of cases in India, in Indonesia, in the whole continent of Africa. These are all places that have very close links to China. The fact that there aren't any cases reported there, is that reassuring to you or alarming because they might be missed?
So we had a report from India, for instance, and those countries are on high alert, so they are reporting alerts. But when they test, they show that the tests are negative so far. And with regard to Africa, for instance, before they didn't have the capacity to test, but recently we have shipped diagnostic tests to those countries. So now more and more countries in Africa are able to test for this virus. And it's not completely surprising that you don't have cases in Africa, because when we did at the beginning of the outbreak statistics on the intensity of air travel from Wuhan to other countries, Africa didn't come first. And the country who came first were Japan, Thailand, and indeed this is where we have found the first exported cases.
Shouldn't you have called an emergency earlier, maybe at the very beginning of the year or even at the end of the last year?
So the difficulty when you make this kind of decision, I mean, the emergency committee met, and the initial data we had, there were very few cases outside China. So really, most of the cases were in Hubei province. And so at the time they met initially, we had, I think, if I remember well, 7 countries reporting 1 or 2 cases. So at that time, the committee decided that they didn't have enough data to conclude that it was already an emergency. But when they met 1 week later with more data, and then we had seen more cases exported, so then they decided that now it's time to raise the alarm and ask other countries to get ready to receive more cases. So it's evolving situation, and the decision you make one day may change the next day, and hopefully soon we will be able to see a trend towards decrease, and then we can make also other decisions on this outbreak.
Indeed. I mean, it's hard to know what to believe, and I know there are many questions that you're trying to answer that you haven't been able to answer yet. But for instance, the man who was in charge of the SARS virus in Hong Kong, a very eminent virologist, has argued that as many as 60% of the global population could be infected by this virus. Is that an outlandish scenario, or is that a realistic scenario as far as you're concerned?
So Professor Leung said indeed that we could reach this proportion of population affected if nothing is done. But it's not what is happening. I mean, many things are done to stop the virus first or slow the spread of this virus. And this is what we are currently seeing. I mean, the number of cases remain increased but stabilized. And so we don't see an explosive epidemic as we could have feared at the beginning of this outbreak. So the measures that are taken are really about slowing down the spread and, if possible, eliminate the virus.
London is, of course, a global transport hub. There are lots of flights coming in from China. We've heard tonight that indeed there is a single case of someone who's been diagnosed with the virus in London. How worried should we be in this city, for instance?
I think what is important is to really understand that there is a risk of importation and further transmission, especially in large urban settings, because there is a lot of people, a lot of movement. However, now we know much better the virus. We know what can be the transmissibility, the severity, and so there are things we can do to protect the people, especially the ones who are most at risk to get the infection and the severe disease. So I think it's time just to confront the threats and just put in place the right measure to mitigate this impact.
And just in one very brief line, it is still the elderly or the infirm who are most at risk here. Children, for instance, are much less at risk, it seems.
Yes, is it true? We see that among the cases, most of the cases that are in elderly population are people with underlying conditions. And so this age group and group of people needs to be better protected. We see mild cases in children, but usually children, so far we have not seen a huge number of severe cases in children. So it seems that indeed severe cases are much more in elderly.